Hello, dear colleagues. This is case number 2 for today, and as you noticed, Kazakhstan is endemic country for stenosis, and the patient is a smoker, active smoker, and Davlet is assisting me for this case, and patient smoker, asymptomatic but hypertensive, and both vertebral arteries are diseased, and artery diameter is 2.6, but I think it's nearly normal part. There is 3 millimeter, 3.8, 3.5. Okay. Yes, patient has some paresis on the right leg, and I think it could be some stroke previously. Yes, intracranial stenosis also, vertebral artery, and there is a cavernous segment stenosis. I see is normal. Okay, let's measure. Yes, and 31, 30, something, 21. .2, 2.8, and both territories on this side. Okay. And it looks like there is an aneurysm, huh? MC. Or it's just a bifurcation. Maybe it's infundibulum.
Yes.
Okay, need to follow. And severe stenosis on the left vertebral. Both vertebrae are diseased, and this is the left side. Okay. We need to treat one vertebral, and I think it would be right vertebral artery, and this vertebral is also not good. It's a subocclusion, and there is also stenosis. That's a 4 millimeter. Okay, let's see the right side also. Yes, the both vertebral will be soon occluded. Так, 2.25. Жана шарм баллоның бар ғой? Сол шармды ашасаңыздар. Иә, кімде?
Интервенцияны алып келген.
Шарм жеріне. Иә, осыны ашып бересіңіз.
Или мынаны.
Шарм жеріне аш. Иә, осыны ашасаңыз. Окей.
И она
хорошо. Иә, ананы аша беріңіз. Шарм. Так,
левый позвоночник.
левый позвоночник.
Левый да.
Кім Зоя?
Okay. Davlet is suggesting to start from left vertebral, but the both vertebrals are diseased, and okay, let's see. On the left side we need several stents, on the right side several, but the healthcare system may cover the stenosis very partially. Just Patient is 69 years old. And usually in Kazakhstan, in this age, 69, 70, the most of the men population is finishing the life. And main cause of mortality is atherosclerosis.
Ondan sonra ne koyamız var? Sigara ile egzot kemik var aslında.
Еще раз.
Ondan sonra один, да? Протежи или сигар коyamız var? Прямой.
Без разницы.
Egzot var, бірақ оны асты.
В любой стороне положить.
Сол жағын жазайын ба? Үш жарым болу.
Так. Сигарет бере бізге. И ловушка бере салшы, сонныйдан бастайық. Жоқ, қандай бар? Короткий болса болады. 9.30 болады. 9.30.
Ловушка берші? Бесіп қой жетілік аламыз.
Жетілік бере салшы. Okay, let's start from right ICA and then we'll see the vertebral arteries. Maybe I prefer to do from the right side. And the left vertebral we can leave for the next time. Он жағын істейік бұл жол. В конце. Асықпай. Okay. Okay, no problem. And you may congratulate us, the control monitor. Touchscreen module is now working and we can measure everything from the operating room. Yes. It took us from September, October, November, December, January, 4 months to fix this problem, and finally it was fixed. Okay, finally it was fixed, and now we can work as a normal people. Just a second. Application, excision, injection. I think something is wrong. Number one, it's not working. No. It's not this. Okay, this is bigger. Артқа 10 сантиметр тартысыңыз. And now we need to save. I don't know how to save. Manage. Okay. This is good. Like this and like this. I like this system for these possibilities. It's maximum. Okay. The referent is better. And now we need to save. Mynzhylky. I will call it Mynzhylky 2. Save. Okay. Okay. Mynzhylky 2. Okay. Now it's better. And now road map is on. Not the mask. Строго. Мадина, экзактно қандайлар бар? Ага.
Неде бар ғой бізде. Ар жағындағы стендтерді аш.
6-8-40 деген бар ма? Каспер болмайды бұл жерге. Okay. Готов? Жақсы. Жоғары жағы 3,5 көрсетті. Okay. Yes, with all guidelines, the vertebral artery stenosis should be managed conservatively, but I have seen very hard strokes, and usually those patients are really disabled and the vertebral basilar stroke is not so good. There is no good strokes, huh? And the vertebral basilar stroke is really disaster. Так, okay, let's do here. Гепарин бесмін. Так, назад. Так, бұл қандай код қоямыз? 30-74 келеді. Да, right. Номинально бере сал?
6 берем ба?
6. We'll give nominal pressure 6. Nominal is 12. 12 берем. Напряжение болса тоқтай сол. Назад. Yes, we gave 12 atmospheres. It's a nominal pressure. Еще раз, уник. Now we will give again 12 atmospheres. Назад. Рахмет. We already asked for 12, for 1 cc is еще раз уник. 1 cc of heparin is 5,000 international units. Yes, назад. And also today we have another patient with multiple stenosis and MCA aneurysm. And that patient, еще раз уник. That patient was diagnosed for coronary multiple stenosis, and it was planned for coronary bypass, but finally cardiac surgeon colleagues decided to do CT angiography, and on CT angiography there is an intracranial severe stenosis, MCA aneurysm, and they asked to start with the brain and then they will continue with the heart. We have a lot of patients with such stenosis, and nowadays it's very hard to operate this category of patients. The Ministry of Healthcare and the insurance system limited the quotation for this category of the patients. Okay. Так, еще раз. Уник. I'll give again 12. And for this stenosis, maybe we will place 2 stents.
12.
Okay. It was nominal pressure 12. Okay. And the guiding catheter is 8 French coronary guiding Hyperion. And the balloon was Mosaic balloon from Medal Company. It's an Indian one, and the wire is Xeon Blue. For the intracranial stenosis and the extracranial, we mostly use coronary 14 wires. Okay, let's see which stent is better. Қазір бір секунд. Жоқ, сигарет емес. Нені бере салшы? Экзакт тартып көрсете салшы. Сол жерге қоя салшы. Жоқ, шығарып бері қарай тартып қоя салшы. Стенкаға тіреп қоя салшы. Wall stent, maybe wall stent we will use for carotid artery, and for this anatomy I prefer to use 9740, 9740, and бір протежен қысқасы бар ма астында? Пока салмай тұра тұрыңыз. Yes, бері шығара салыңыз. Yes, and protege is 6840. First of all, we will place exact, and then maybe we will place protege. Exact assurance. I have seen from my Armenian colleagues and friends, Mikhail Grigoryan and David Saakyan. A couple years ago, I have seen for the vertebral artery stenosis, they prefer to use coronary long stents, but it's my personal point of view for the intracranial stenosis, for the vertebral V2 segment. I think the better stent is self-expandable carotid stents, and there is no guidelines and recommendations for the material, and usually it's expert opinion, and my opinion, the protege or something like protege is better for this anatomy. I think we should start here, and then we can protege наш версия. We can cover with the second stent proximally. It's a 9740 exact stent from Abbott Company. And it prevents the damage of the stent with the neck movement. Okay, let's do angiography. Okay, yes, no problem. And after we can do post dilatation. Трубку было шпиц перед чем? Значит, тройка шпиц перед. And the protege stent will be 6840. Бересің шпиц. Okay. Бір wall stent ашып бере салшы. 730 деген. Wall stent. 730 бере берсеңіз. And for ICA 930 ашсаңыз. 740 деген жоқ па? Қайсы бар? 740 ашсаңыз. Окей. Аға, қозғалмай жатыңыз, қозғалмаңыз аға. smartphone? Все ошибся. I prefer to leave the proximal part of the stent in subclavian. And I noticed sometimes the stent may shrink and may go into the vertebral artery and cause this stenosis. Yes. And for the coronary intervention, it's possible to go around the protege and there is no problem. And now we'll do post-dilatation. I became older and older, huh? It's very hard to find the hole of the balloon.
Кофе.
Yeah, it's after coffee. Okay, I need to measure my blood pressure. Okay. Post dilatation with the same balloons, 3.5, 23. One third person. One third. Опускай. Так, енді тек 12 бере бер, 14 бермей ақ. 12. I'm asking Davlet to give 12 atmospheres, not 14. Назад. 12 is nominal pressure for nominal diameter. Okay, тогда 12. Ора бер. I especially keep my balloon inside the stent to prevent any kind of dissection. The angioplasty may cause dissection, and usually it's okay. We'll use the same balloon for IC stenosis. Okay, now this territory is better, and the same problem on the left side. Maybe we'll do just an angioplasty and then we'll see. Stop. Okay, no problem, it's okay. Now we can go to the IC territory. Let's look like IC territory. No, it's not IC. No, it's IC. Okay. Just a second. По списку берешь? Okay. Give me the filter. The filter is Pronder. Pronder is from Lepomedical, a Chinese product. It's a very good copy of Spider from Medtronic. Yes, and nowadays we are using mostly the Pronder, and comparing with the Spider, it It's very soft and it may go through the any kind of any kind of tortuosity and kinking, coiling, and it's not a problem. It's quite nice device. Okay, let's leave it here. It's a 7mm filter, and I prefer to use 7mm. It's better than 6 in my opinion. It's also the personal point of view. It's not a standard, and there is no standards here. And this is wall stand carotid. And this is the preparation. Okay. Yeah. I'm asking Dawlit to flush the hub of the wall stand. Алдында smart mask koyuyorsunuz. Oh, okay. Just a second. We need to do angioplasty. It's a wall stand. It's better to do angioplasty first. Yes, and today I'm planning to finish at 6:30 p.m. It's India time 7 p.m. and as much as possible we'll operate the patients, and the rest we'll plan for tomorrow. Okay. Сразу дерьмо беру. I'm asking for 20 atmospheres. Very gentlemen. It's a 24. Назад. Joke is wrong. Couldn't. Sorry. Sorry. Second. No, customer second. Yes, it's a braided stand, self-expandable, and it's possible to resheet and unsheet with no problem. It's very nice stand, huh? René prefer to do everything with wall stand. I don't understand, but it's quite nice stand, huh? It would be a little bit longer. Just a second. Yes, it's possible to resheet, and we can place a little bit up to cover only the IC territory. Yes, the artery is stenotic. Now IC is covered. Oh. Job. Yes. Yes, the problem is tender at the beginning of the year, and not all material is available on the shelf. That's why the balloon is 3.5 millimeter. Okay. Бір түрлі жүр. 24 бересің. I asked for 24 atmospheres. 25. Все надо. Yes, 24, 25 atmospheres. Еще раз.
Выше, чуть полосочек. Совсем еще не.
Осла?
Yeah.
25 пересел. Ага, назад. Yes, it's quite hard plug. Yes, it was critical stenosis, 1.3 millimeter, now it's more than 3 millimeter. It's okay.
Как вам это?
It's okay. It's okay, everything is okay. Okay. Yes, now it's better. Yes, it's clear. Okay. Вперед. Now I will do one more angiography for the vertebral. As the vertebral is okay. Yes, it's okay. Now we will go to the left vertebral. Okay. Usually it's a contralateral cranial angulation. Like this is better. Why it's not going? Smart mask. Okay, let's take the same balloon. Стесишь? Да, уник. Он только переснял. Ливер. Уник. Okay. Start right. I'll keep it a little bit and then I will move it a little bit like this, and then I can. Все назад. Открой. Открой. Смарт мозг. Стоп. Назад. Сюда. Вон тут. Дерьмо выросла. Ага, дерьмо. Стоп, травишь. Bir protej açıp beresiň, 6-8-40. Назад. Ага. Еще раз. Жирма. Жирма. Oraya verirsin. Aşağı verirsin. Hı? Yazılmaz. Stop driver. Yes, and this patient was consulted by my young colleague, my friend, and my student Nurjan, and Nurjan said he has no quotation in the private hospital. That's why for the treatment of this stenosis, the price for the treatment in the hospital without insurance, it's nearly 4 million tenge. It's just $8,000. And you can count all the material and the price of the treatment. Yes, it's approximately will be 3.5-4 million tenge. Yeah, 3.5-4 million tenge. That's why. And after finishing quotation in this hospital, the patient with stenosis should pay for the treatment. The simple carotid stenting price in our country will be approximately $4,000. And I know the prices in Tashkent. In Tashkent, the price will be nearly the same. Yes, this is better when we leave the protege in subtraction. It's better. Yes, we have some quotation. That's why patient asked to be treated in this hospital. Oh, normal. I think it's okay. There is a irregularity, but I think for this treatment it's enough. Yes, I think it's enough. Might be some. Yes, it's a problem, and I know the India, and in India, nearly all patients are private, and till this year, in our country, all patients, nearly all patients, was public, and there is a changes in insurance system, and now patients should pay for the treatment, the part of them, and the insurance system is cut the financing. There is some kind of dissection in vertebral artery. Вперед. Чуть-чуть диссекция. Angioplasty usually cause dissection. It's the effect of angioplasty, and we'll give heparin, low molecular anticoagulation, and then maybe next time it's needed to place another couple of stents in V2 segment distally. We will see. Okay, now I will ask Davlet to do expert CT, and we can finish this case. Okay. Okay, now we have this machine. This is very good. For me, it's very good. Expert CT. Now we can do everything from here. Okay. Okay. And the mouse is working. It's nice. Just a second. Келесі пациент шақырдыңыздар ғой, да? Я место. Звук можно пока выключить. Expert CT is ready, the brain is normal. Okay, see you in next 20 minutes. Next case is also the stenosis.
Они выдвинулись.
The second is this next case with the aneurysm and stenosis. See you in 20 minutes, yes.